This is my continuing coverage of the healthcare law. We are on page number 79, and in the last video I read you a statement that said front-end prepayment intelligent data matching technology, and I promised you guys I'd look this up. I didn't find a whole lot of information on it, but I did find some things, and what I did find I will now share with you. When you're talking about prepayment intelligent, what it is you'll be given a chip or a card. You may be even given a flash drive, okay? And before you receive any medical treatment whatsoever, you'll have to produce this flash drive or this chip or this card that will tell them that yes, indeed, you have paid into the system and now you're qualified to get the health care you need. Okay? And this would be the same thing when you're trying to be billed for this community health insurance initiative. Okay? And that's what they're talking about in prepayment intelligent. Okay? Now, data matching, that is where they don't want to resort to using your Social Security number to match you with your medical payments. Okay, so they're trying to find some other number to use to match you with your payments. Say, well, it is you, you have really paid, so on and so forth. Okay, that way they identify you without having to use your Social Security number. So that's what that's talking about. Okay. Now, the next part says term. A contract provided for under paragraph 1 shall be for a term of at least 5 years, but not more than 10 years. In other words, if this community health care service does form, okay, and many of them already have, then the Secretary of Health and Human Services will sign a 5-year contract bare minimum. So in other words, he'll be supporting them for a bare minimum of 5 years, but not more than 10 years. In other words, at the end of that 10-year period, the Secretary of Health and Human Services may say, okay, I'm not supporting this community health care initiative, I'm going to support somebody else. Okay? At the end of each such term, the Secretary shall conduct a competitive bidding process for the purpose of renewing existing contracts or selecting new qualified entities with which to enter into contracts under such paragraph. In other words, at the end of the 10 years, what's going to happen is there's going to be different companies that are going to bid and say, hey, we'll be your community health care initiative. I know these guys have been this for such a long time, but we can do better. And if the Secretary of Health and Human Services believes that they can do better, he'll say, hey man, I'm dumping you guys and I'm going to go with these guys instead. Especially if the opposition is more cost effective than the ones he's been supporting so far. Or she, the one. Okay. Limitation. A contract may not be renewed under the subsection unless the Secretary determines that the contracting administrator has met performance requirements established by the Secretary in areas described in paragraph 7b. Audits. The Inspector General shall conduct periodic audits with respect to contracting administrators under the subsection to ensure that the administrator involved is in compliance with this section. In other words, this community health initiative is going to be checked out by the Inspector General on a regular basis, and if they don't, if they're not found to be compliant like they're supposed to be, yeah, they lose the contract. Revocation. A contract awarded under this subsection shall be revoked by the Secretary upon the recommendation of the Inspector General only after notice to the contracting administrator involved and an opportunity for a hearing. The Secretary may revoke such contract if the Secretary determines that such administrator has engaged in fraud, deception, waste, abuse of power, negligence, mismanagement of taxpayer dollars, or gross mismanagement. An entity that has had a contract revoked under this paragraph shall not be qualified to enter into subsequent contract under the subsection. Alright, so if the administrator of this healthcare, its community healthcare initiative, is found to be defrauding his I wouldn't call them patients, I would call them more of his enrollees. That would be a good way to say it. If he's deceived the enrollees, he said, hey, look, you're going to pay one price, and then later on they find out they're going to pay a different price. If he has wasted money, you know, he's spent too much money on administrative costs and so on and so forth, or for any of these other reasons, okay, the Secretary of Health and Human Services will cease his contract with the Community Health Initiative and will not create a new one. Fee for administration. In general, the Secretary shall pay the contracting administrator a fee for the management, administration, and delivery of benefits under this section. In other words, for as long as this administrator runs the community health insurance thing that they've got, the Secretary will pay that administrator a certain sum of money to continue his activities. Requirement for high quality administration. Boy, this just gets longer and longer, doesn't it? Okay. I'm going to stop the video right here, and I will tell you more in my next video, so stay tuned.